Welcome to the podcast, you guys. I'm so excited to have back my dearest, loveliest, smartest person I know, Dr. Chris Miller. How are you?
I'm great. Thank you, Lori. So happy to be here again with you.
So happy to have you. So we are doing our monthly collaboration. You are one of my three peoples. You got you, Chef Martin Oswald, and Dr. Judd Brewer, who we bring on. We're going to talk about you and your expertise and everything that you have to offer. You have a Substack, the Dr. Chris Miller Substack, and some really cool stuff that's going to be coming. You just got started, but sharing your story. But we're going to talk a little bit more about that here in a second. But just to highlight everyone, Chris was on the podcast. You can go back and read it. We talked deep dive about her story with her lupus, and in her journey. But today we're going to highlight a little bit differently about inflammation and her story as a, functional integrative, all sorts of lifestyle medicine doctor and ER doctor, all that. How many specialties do you have? I don't even know. Like 10? It's like
I
insane.
trained in internal medicine, but I didn't get boarded in it. But I trained in emergency medicine, got boarded, and integrative medicine got boarded, functional medicine got certified, lifestyle medicine, I just am a member of. So
Oh, ridiculous. So at least four or five. It's like talking to someone and they tell you, "Oh, I only speak five different languages." Yeah. So that's kind of like Chris with medicine. So very, very interesting, really unique perspective. Plus, she had her own journey, you guys. You don't want to miss this. Definitely go subscribe to her Substack. All that's linked below. But Chris, let's go deeper a little bit because we've spent we, we were scheduled to start this podcast like an hour and a half ago, but we spent the last hour and a half talking, and we really got some cool stuff that you were sharing about your own journey. And so, can you just briefly give us a quick rundown of your history? And then I really want to dive into, you mentioned you had to dig deeper into the root causes of inflammation, and nobody was able to help you, and how you figured that out and how you work with patients now. So, I'll let you take it from there.
yeah, thank you. So yeah, I've shared a lot about my journey, and you can read about it in Substack, and Lori and I have talked about it previously. But basically, I was working in the emergency room as an ER doctor, and I started to get joint pains and swelling in my fingers, which progressed to like joint pains and swellings all over my body, and fatigue and hair loss, and just feeling horrible. Basically, diagnosed with an autoimmune disease, lupus, and it was pretty extensive, pretty inflamed. I mean, I was a pretty big mess. All my inflammatory markers were positive at that time. So I, for the first year and a half, took medications and just kind of followed what the rheumatologist said. And this is like 15 years ago now, I think, um, 2008. So, uh,
17.
diagnosed. And so, yeah, 17. Wow. And so at that time, there were no blogs out there. I didn't know anyone using diet or lifestyle as medicine. It was before I had seen any of this. And so at the time, I just followed the regular recommendations, but I kept getting worse. It was really progressing. None of the medications were working. I was on 6 different ones, and my immune system was crazy out of control. And so they were going to put me on some experimental drugs because we were running out of options. And so that's when I started Googling what else could I do just to feel better. And so then I came up with plant-based eaters and learned about people actually reversing an autoimmune disease with the plant-based diet. So I was like, oh my God, this is crazy. So we packed up our bags. My husband and I came along, and there was a conference coming up in like less than a month. And so we signed up and went out there for a weekend. And it was Dr. Furman at the time was the first one. And then I went to several others after that from different people, but learned all about the power of plant foods and how people can reverse, and you can put out inflammation, and people with all different kinds of autoimmune diseases were reversing. So I jumped on board, immediately switched my diet and went in. But this is where I talk about my journey part. Over the course of the next about 10 years, I did not reverse it. And I continued to have problems, and I joined program after program and would follow it for 6 months, a year, even for some of them. And about a couple of those journeys because you helped me when I wasn't doing well on it, told me that maybe I should do something different. But
Mm.
I just didn't get better, even though other people were. So my journey just kept taking me harder and harder places. So that was the reason that I trained. After when that wasn't working, I trained in integrative medicine to learn about mind, body, and vagal nerve and what I could really do, because I knew a lot of it was my stress and me, you know, worrying about it so much. So I worked really hard on that, and then I joined functional medicine because I wanted to get to root cause. What was going on with my immune system? What was going on with my microbiome? What was going on with my genetics? Like why am I not getting better? Like what is happening at a cellular level? And so
Mm.
I studied that. And then I started experimenting much more with myself than I had previously and started finally getting answers. So that's kind of my
Mm.
story.
Okay, so this is really important. So you did kind of your journey with any disease. Sometimes people will transition to their diet or do something that they've read about someone else having great success, and then they don't. And then you almost feel like, wow, it's not working for me. What am I doing wrong? There's a lot of judgment. And that's a really frustrating place, right? When especially when you're a physician and you're looking at the science and you're seeing those stories. But what was awesome about you is that you dug deeper and you're like, okay, this is one layer, let's go deeper. So let's walk through, what does that look like now that when you say you dug deeper and found more answers, like what were those answers? Where did you look? What did you find?
Yeah, so this will be my Substack. So if anyone's interested in reading the details of it, I'm working on
Yes, yes.
it. But so I was so on board with the idea that food is medicine and you eat this most healing natural foods and you heal, but that didn't work for me. And so clearly my body was not responding the way other people's were. So I have a strong belief that our bodies are meant to heal, that our bodies know how to heal, like it's an intrinsic, intelligent physical body that somehow knows, right? And so I strongly believe that. And if my body's not healing, then something's not right. I'm not doing something right, or there's something missing. Not to blame myself, but just meant maybe this wasn't the right system for me. You know, I needed to figure out why or what was not responding. And one of the things that you and I were talking about ahead of time was, despite me eating what I thought was the most anti-inflammatory diet that I could, and I was doing my mind body work, I was very serious about my mind body work, very committed to that, and trying to get the right amount of exercise. Like I was trying to do all these things the best that I physically could do, but I still had elevated inflammatory markers. So my C-reactive protein is one of them that we check people, and the high sensitivity one stayed persistently elevated. So despite everything I was doing, it was always elevated. And there came a time, you know, I would double down on my diet, more raw foods, more juices, smoothies, salads. You know, I did all raw for over 6 months, and that didn't touch it. In fact, my inflammatory markers went up. I really did not do well in that program. And then I did water fasting for 16 days because that's supposed to lower inflammation, but the CRP stayed elevated. And it's like everything I did, no matter what, no matter how much I tried to double down on things, I've doubled down on stress management and, you know, went on a trip and tried to do this retreat with more mind body work and meditation. And it just was not lowering. And so then I was talking to all these different people, from my doctors to experts who helped other people with autoimmune. And they said to me, well, sometimes you just have chronic inflammation. People with an autoimmune disease like lupus, it just doesn't go down. And that was it. Like people didn't know what to do with me. And so I was like, huh, well, something's clearly triggering it. So that doesn't make any sense at all to me. We just don't know what it is yet. And we always hear like inflammation is the root cause, but what was the root cause of my inflammation? That's what nobody had told me, or I didn't know. And food alone was not doing it. So, and now I see that every single person is individual. Food is one very important component of inflammation, very important. And a lot of people, they can change their diet and their inflammation drops and they can reverse, and that's awesome. But that's just one part of it, right? We're these complex, holistic beings. And so without touching anything else, that clearly wasn't enough for my body. So
Mm.
that's where I started digging deeper. And I went into things like, gosh, I have checked I mean, I've just feel like I've done so many different things for myself. But I found out that I had celiac genes and gluten sensitive, so I have severe gluten reaction. And I was already gluten free, but I was still was making gluten antibodies even on a gluten free diet,
Mm.
because there's a lot of crossover. So there's several foods that are known to cross over with gluten. And so I was so highly inflamed, and my gut was so, it was just letting everything through, right? The leaky gut or hyperpermeability. And so the diet it just was not nearly enough without taking care of, I had to get more strict on certain foods, and I had to fix my gut, right? It was such a mess. And just again, food alone was not fixing my gut. I wasn't repairing, I wasn't actually changing the microbiome. I did several microbiome tests and found, got a lot of answers from that. And over time have evolved it and made a lot of changes based on that. So that's been very powerful for me. Um, but yeah, I did some genetics testing, so I learned some deficiencies that I have. So I've
Mm.
turned over a lot of different things and found a lot of things about myself that diet alone couldn't have corrected because of the way I'm put together. And so I have now tailored my diet differently, and I have had to overcome some of these deficiencies that I found when I was looking for. So, yeah.
Can you highlight the genetic deficiencies if you don't mind? Like, what does that mean exactly when you
Gosh,
say
there's
genetic
kind of a lot,
deficiencies?
but
There's
so
kind of a lot.
well, we're all made differently, basically.
Right.
And it's not like anyone's good or bad, but like, let's say the detoxification. I just wrote an article on this. And we all have detoxifying genes. So the way that we clear, like even our hormones, estrogen breaks down, or my thyroid breaks down, and you got to excrete the waste. And we have detoxification genes. But some people have deficiencies where you don't make as much of, let's say, glutathione, which is the master detoxifier, the master antioxidant. It's in all of our cells, and it really helps clear out waste. And it's very powerful. Some people can't transport it as well. Some people don't make as much of it. Some people, it doesn't bind and doesn't work as well. And so I found some deficiencies there for myself. And so even if I'm eating all this good food, I wasn't clearing things as well as other people do. And so this really affected me. And then things like, um, yeah, so that's just one example. But I found some different genetic abnormalities that really seem to play a role. And so I have tailored either different supplements to help overcome it, or different food, like diet type things that I've tried to do specifically for it. And it has made a difference.
Mm. So when someone comes to see you, because you're licensed in how many states now?
I'm in 23 states right now.
So 23 states, almost half the United States. Amazing. So when someone comes to see you and they can see you, what's your website? Dr.
It's my
Chris,
name, chrismillermd.com.
chrismillermd.com, guys. It'll be linked below. What can they expect for someone? Like what is the questions? Like where should they begin? Like should they bring certain records, or how do you even begin that investigation for someone that you're just like, oh, they're usually a mess too by the time they come to you, I'm sure, because you're kind of like if they come like to me, they're like, I can't get my diabetes reversed. I've seen everybody, but when they come to you, like I'm a mess with inflammation. What does that look like for you?
Yeah, so I have an intake form which I've tailored to ask the questions that I think would be helpful. So it's
Mm,
very comprehensive, getting to know a person, all about someone's history, because we're looking for keys, right, from their childhood, from birth, about their parents, all sorts of exposures. I'm asking about that. So they filled that out. It's about 5 or 6 pages, I believe. It's in the
wow.
computer, so they fill it out before the first visit. And then, yeah, people can upload previous records or labs. And then we go over it, what's going on, and we go over that intake form together, and
Mm,
whatever the current concerns are. And then really it helps to do a little bit of labs and kind of, or see their recent labs if they just hadn't done, and start to paint a picture. And we're trying to understand this person holistically. So we're looking at previous factors that could have contributed, what caused it, who this person is, like, because there's so many factors that affect us. Like my immune system was hyperactive, but it wasn't until I dealt with my mind body part, and really helped that. It wasn't until I got the right foods for my body, that I healed and I improved my gut health, and I took care of these genetic deficiencies. So it's like a big picture. So with each person, we're going to go through this, and I kind of have a system. It's through the handout that it will kind of tee it up, and then we'll do a little bit of blood work. And many of my patients come in have had a lot of different advanced testing, so they share what they've had, and so we can go through that kind of quickly. And we're trying to paint a picture so we can understand each person.
And I would say that part of your journey is also perimenopause, menopause, and you dove deep into hormones, and you can help them
Yeah.
with that part aspect of it too, which raises inflammation.
Yeah.
Um,
Right. I see menopause is an inflammatory state because it's a release of
oh,
cytokines when you're having hot flashes. And when that happened to me, I wasn't having terrible, but even having like one, I was like, I don't want any cytokine releases, not with my immune
mhm.
system being so, sensitive. And so I definitely delved in, and nobody wanted to touch me with that either because I have this autoimmune that is, nobody wanted to do anything with hormones. So I trained at the Menopause Society and learned like the nuances and got
I
to,
was willing to treat you
yeah,
100%.
right. You
I
and I were
was telling
talking
you
about,
to go do it. Yes.
right, right. But
So
when I
important.
talked to like my regular doctors, they, I was
Yeah.
like, what do you think about this? And
Yeah.
nobody wanted to touch me. But yes, you and I talked about it. And so now I understand that, the benefits of it and how it can affect autoimmune diseases, and it can increase inflammation. So it's the haywire estrogen that it does cause problems in those of us with autoimmune. And so if you can get that to be at a more stable level, plus
Hmm.
I always think about with people with autoimmune disease or any chronic illness that you're also at risk of other comorbidities. So once you go
Mm.
through pause, now you're at risk of bone health and muscle mass, losing muscle mass, and you're at risk of cardiovascular disease significantly increases around the menopause transition. And so if you can help stabilize hormones, what a difference that can make in people, the people that are safe for it, that it does make
Mhm.
a difference. So that to me, the data was very compelling, and
Mm.
it continues to be compelling. So you and I
Mhm.
talk about it quite a bit, but we're both very interested in this topic, and
Mm.
yeah.
Yes. Yes. So you're doing well. I did the menopause certification as well, just because my own journey was so horrible in doing everything right, plant-based diet, the exercise, everything. I totally get it. But in the more you learn about it, like the more the data comes out, it's like, man, why wouldn't someone, unless you're in just really high risk of certain things?
And I mean, you have to remember now that we're doing topical and it's a different form of estrogen,
Yeah.
you're bypassing the liver. So the risk of the clot, I mean, some of the risks that they saw, then it just doesn't exist. And then,
Well,
the data, it's just,
yes, and even the breast cancer risk, if you go look at the WHI, non-statistically significant when they took it, the estradiol and the progestin, and then also in the estradiol arm, they actually had a lower risk of breast cancer. So when you look at these things and look at the data, look at the context of when that stuff was reported, how it was, there was a lot of interesting maneuvering. Anyway, there's a great book called Estrogen Matters, and I would encourage anyone to listen to it or read it. It's a really compelling deep dive into the science, and they give the context around all that. And it's utterly fascinating. But anyway, so you dive into genetics, you look at the whole person, you're looking at history, hobbies, food, movement, sleep, stress, all those different things because you've learned all the different levers and understanding that really important piece. You kind of mentioned, well, one, you're an expert in inflammation. So if you're looking for someone who's an expert in inflammation, Dr. Chris Miller is your person. And when we look at that, can we give a little bit of context of what actually inflammation is? So we talk about inflammation, but you said, yes, people say inflammation is a root cause of current disease, but like, what is the root cause of my inflammation? Like, that's really very interesting. So can we just even describe what inflammation is, what it looks like in a person and their blood work and their body?
so inflammation is actually part of your immune system, and it is the first line of defense if there's anything that your body feels it's exposed to or attacked. So your inflammation will go up if you're injured, and they're the cells in your body that are being drawn to the area that's injured to help it heal. So it's things like histamine that cause the blood cell to dilate so that you breathe, like you twist your ankle. What's going to happen? It's going to turn red and warm and swell. Well, how does that happen? Well, that's inflammation. That is the blood cell. The blood is going to that area, and the histamine is being released so that it expands the blood cells, the capillaries dilate, and you get leakage of these plasma cells, these blood cells, these white blood cells, and things like fibrinogen, all these cofactors, they're pulled into that area. This is all the immune system that is reacting to an injury. And so you want that. You need obviously we need inflammation, right? You got to heal this twisted ankle, or if you get a cut or surgery or something, inflammation is absolutely necessary. And that's what's happening. This process is happening. But what's also, there's two parts to acute inflammation. And this first part is bringing it all there, and then they do the repair. And then the second part is it has to turn off, and that acute inflammation has to turn off. And so people with autoimmune, it doesn't always turn off that way. And so you keep having the ongoing inflammatory process, and it becomes chronic inflammation. And two, we have other factors triggering inflammation. So we have all these other things that could be causing this inflammatory process besides an injury. You can get inflammation if you're exposed to a virus. So if you get exposed to any virus at all, a cold, a flu, COVID, you name it, you get exposed to it, your inflammation is going up because your inflammatory cells, which again are your immune cells, and these are the ones, the natural killer cells, and the IL-1, IL-6, these are the cells that are your inflammatory cells, part of the immune system, that are going to go and try to get rid of this virus right away and get rid of it. So a lot of times we don't actually get sick from an exposure because our immune cells, the inflammation goes up and you can get rid of it. And if I do blood tests on someone, and then sometimes I see the CRP, inflammatory marker, come back at like 6 or 7, and they're typically very low, less than 1. And I say right away, I'll send them a message. Did you get sick right after this? Or were you exposed to something? I can almost always tell, because it goes up with an infection. So that's what inflammation is. It's to help us overcome infections, any exposure, to repair ourselves. So you can see how important inflammation is. But it's the chronic inflammation. And with chronic inflammation, you start making antibodies. That's the second line of defense. And you get more T cells that are very specific for whatever's going on. And the problem with this ongoing inflammatory process is it leads to errors. And these errors are, instead of just attacking the virus or attacking repairing the ankle, let's say, as is in those two examples, that you start actually making antibodies against yourself. It's called molecular mimicry, where your own body starts to look like these antibodies that you're making against the exposure. So your body starts making mistakes. And I like to think of it like a police officer working all night long, really busy. And by the morning and the next afternoon and the next day, they're just working straight with no breaks at all, can't sleep. You're going to start making mistakes. Your body's on hyper drive, and it's going to start making mistakes. And that's what molecular mimicry, where it starts attacking yourself and you start getting autoimmune. And that's one documented way why it happens. Like after COVID, people started having autoimmune symptoms and problems because they were attacking this virus, which mimics our own bodies, and people started making cells against them. So it's a very common known way for that to happen. So that's what inflammation is in a nutshell.
That's a very big nutshell. And so, yes, I think it was a brilliant way to put together a very complex and sometimes very confusing landscape. And if you don't have someone who understands the details of what all that looks like and the different levers, I mean, it can overwhelm even like your primary care doctor, someone who's not well versed in what that looks like. I'd like to highlight some of the more common lab tests that even primary care doctors might order. For example, so you mentioned the CRP, the C-reactive protein. And of course, there's HS, the high sensitivity CRP. Would you mind just talking a little bit about that CRP? And then there's a few others I think we should highlight for people just so that they can understand what they are.
Yeah, there's several markers you can look at for inflammation, and a lot of them you get just from your regular doctor. The CRP in general, like rheumatologists will do a C-reactive protein, and that is made in your liver, and it's made in response to any inflammation in the body. So the CRP is a good marker showing if there's any other inflammation. So that's why it's a good basic test to get always. And they used to just do the CRP, but then in the cardiology world, which I also do a lot with that, they found the high sensitivity was even more sensitive. People with a high sensitive CRP greater than 3, and an ideal is even less than 1 of the high sensitivity, that those people are at higher risk of cardiovascular disease, because we know cardiovascular disease is also an inflammatory process. And so it's inflammation happening in the blood vessels in the heart. So they started looking at it in the cardiology world, but it translates into everything. So if your CRP is elevated, your high sensitivity CRP, you want to get that tested with your doctor. Then that does put you at higher risk. At elevated inflammation means you have these inflammatory markers going all over, too much of it, and that's a problem. And it's going to put you at risk, and it damages blood vessels, and it damages the brain, and it increases blood sugar, and it does all sorts of things that you don't want happening. So you want to figure out chronic inflammation. I mean, in acute, you get exposed. I'm happy it's going up because it's fighting the virus. That's what we want to see, but it needs to come back down. And someone like me, it didn't come back down. So I had to figure out how to turn those knobs to get it to come back down. But so that's why CRP is such an important one.
Okay, perfect. And so the other one we get is a SED rate, as would be another one that many times docs will order. And then I'd also like to highlight, would there be ever a case where one is high and one is low, and why would that be?
Yeah, it happens all the time, actually. So SED rate is measured by the blood cells, how fast they fall. And so if they fall slower, then the SED rate goes up. And I guess it's if they're more inflamed, then they're going to fall slower and the number goes up. It goes up as we get older anyway. So an 80-year-old or a 100-year-old is going to have a higher one than a 20-year-old, right? That's just basic, and that's okay. It's okay for it to go up just a little bit, over the time. It's nothing too significant. But if it goes up, we see in autoimmune all the time that one will be up and not the other. So they don't totally correlate. The CRP usually goes up if the IL-1, IL-6, tumor necrosis factor go up, then the CRP goes up. The ESR is a little bit more specific to what's going on. Like certain autoimmune diseases raise SED rates. So something like giant cell arteritis or PMR, polymyalgia rheumatica, that raises ESR. And we know if we see a high ESR and someone's having those symptoms, that's exactly what it is. So it goes up with certain specific things, whereas the CRP is a little non-specific. But sometimes you will have an elevated ESR, so something specific is going on, but the systemic inflammation, the liver is just not picking up on that. So you're not having the same systemic inflammation.
Interesting. So that's ESR. And then I would say another one would be the ANA, right? So they'll just order like this general ANA panel. Can you walk us through what that is exactly, and the ratio? Like, when should it be concerning? When is it considered normal? How often should we repeat it if it is high? Like, what does that look like?
So the ANA, the anti-nuclear antibody, those are antibodies to the nucleus, basically, of a cell. And so there's like in my lab, elevated ANA could be 11 different connective type tissue diseases. So things like lupus, Sjogren's, what else? Connect connective tissue disorder, just the general one. So, and a couple others. Well, there's 11 of them. So those are all related to an elevated ANA, and there's probably even more that we don't know. We only test what we know, right? But there's so many more that we don't even know. So if an ANA comes back positive, what that means is you're starting to make antibodies against your anti-nuclear antibody. And some people can make a few antibodies because sometimes our bodies just make mistakes and our bodies can clear it. We're always making new white blood cells, we're always making new immune cells. So just because you have a few doesn't necessarily mean anything, but as it starts going up, I say it gets you on the autoimmune spectrum. Doesn't mean someone has an autoimmune disease. Like for lupus, you have to have certain criteria. You have to have double-stranded DNA. You have to have certain symptoms. You have to have, it has to be for a certain period of time. You have to have the ANA. So there's certain criteria. So you may just have an elevated ANA and that's it. And you may find that. So you're not diagnosed with an autoimmune at this time, but you are on the spectrum, meaning you're starting to make antibodies. So if you don't try to figure out what's going on, make sure get your inflammation down, try to figure out why you have that, and start making some real changes so that you don't grow into it. Because once you're on the autoimmune spectrum, you are at high risk of making more antibodies against different parts of your body. So just because you have one autoimmune disease, you can now have a second and a third, and because your body's making these mistakes and now targeting yourself, it can keep on doing that. So I see a positive ANA as one, what's going on, and two, let's nip it right away. Like, and a lot of doctors will say, oh, don't worry about it. You know, a lot of people have it, and it's true. People will be positive ANA with no symptoms for like 10 years when they check military people before they're actually diagnosed. But if you can catch it when it's just that positive ANA, you can reverse it. I have a lot of patients who go positive ANA to negative ANA. So by making some changes early on.
So let's say that you have someone who bumps up from, so the 1 to 40 and below is negative, normal. And you have someone who's in that low threshold, like let's say 1 to 80. Let's say that they're doing what we think is everything right. How do you dive a little bit deeper? None of you necessarily having symptoms of inflammatory or autoimmune disease. Like, how do you detect what it is that's causing that one little trick? Or do you recheck it in a particular time zone? Like, what does that look like? Because I'll have people bring, positive ANA tests. I have no idea what the context was when they first got them. Like, it's one thing if I'm ordering it, it's a whole nother when I'm seeing it. So what are your recommendations from that standpoint?
Yeah, I would recommend what symptoms are they having? So if they're not having symptoms, that's different from someone who's having symptoms, right? So uh
Mm.
and two, I always recheck it. Yeah, because it goes up and down. It can go up and down depending on what's going on. When inflammation goes up, it can go up. And when inflammation comes down. So first I would just start a general plan, with an highly anti-inflammatory diet, really targeting that and the lifestyle changes, and start with a simple plan and see if, and then retest it. And oftentimes that alone will do it. But if that doesn't, then I would start to look a little bit deeper to find out a little bit more what's going on with that person.
Would you also say like in 3 months, repeat it, month, repeat it?
I give
What's
it a
the
little
length of a
longer.
lifestyle intervention?
ANA can sometimes take a little. I mean, if someone did it and they're not having symptoms, then yeah, you can just repeat it. But if it really is elevated, sometimes it can take longer to, like, their symptoms will get better, but the ANA stays elevated for a few months. It
Yeah,
lingers. So I give it a little longer. And it's an expensive
3 to 6
test.
months.
So I would do more like 6 months, give it a little more time.
6 months.
But unless someone
Cool.
had it a little bit ago and they just want to recheck it and see if it comes back. But I'd make some lifestyle changes initially and recheck it.
Cool. That makes a lot of sense. Okay. So I'm trying, those were the main ones. So what other lab tests could pop higher with inflammation that
Yeah,
someone might
so
not realize?
your regular doctor does your CBC, and the white blood cell count goes up with inflammation. So even if you run normally 4 or 5, and now it's higher, that's the first sign. You might see increased neutrophils. You get it with a differentiation. You can start to see a change in numbers there. And even if someone typically runs low, your normal white blood cells 3, let's say, and now it's 5, it's still in the normal range, no problem. Your regular doctor is probably not even going to flag it. But if that's an elevation for you, so you can start to see inflammation. And we know something's going on when someone has a white count over 10. Usually it's an infection or an injury or or an autoimmune flare or something is going on to trigger that. So the white blood cell, that's an easy one. You can see inflammation in your ferritin, which is your iron storage, and that's an inflammatory marker, and that goes up with inflammation. So if someone has a high ferritin, I will turn to them and say, I'll start to look at inflammation and ask what's going on at that time. And there's a bigger picture, you need to look at all your iron levels and what was it typically. So, some people just have increased iron storage. And so you got to dive into that as well. But it can be just inflammation. So autoimmune people will have high ferritin often. And then back to the CBC, I guess I should say another thing with inflammation is you get anemic. So you might have a low hemoglobin and hematocrit, and that's inflammation. Inflammation at the bone marrow level, you're not making blood cells. So you'll see a lot of autoimmune people, rheumatoid arthritis, lupus, connective tissue disorder, but other ones too, even thyroid people will have a little bit of anemia, even just borderline anemia. It used to be called anemia of chronic disease.
Mm.
It's anemia of inflammation, basically. But so that you can see that. And then you also can see high platelets. So if I see someone who's anemic, they have high platelets and a borderline white count, that to me is inflammation right away.
Mhm. That's perfect. Yeah, those acute phase reactions, right? So you will have the white blood cell, the ferritin, the platelets on occasion. Let's talk about other things other than autoimmune disease that also cause inflammation. So, one thing I'm always highlighting to people is that white blood cell count when they see it. As someone who's morbidly obese, typically BMI over 30, you will definitely many times see that chronically elevated white blood cell count. And so, it might hit 12, 13, 14, 15, 16. Then they usually have other indications like diabetes and stuff. So can we walk through why that happens, on the fat cell level, what's happening in the necrosis and the and all that type of stuff? Like, what are those other things doing that cause inflammation? Like why would diabetes cause inflammation, or why would inflammation cause diabetes? Like what does that picture look like, underlying chronic disease type of thing?
Yeah, it's all linked, just so you know. Um, it really is. And inflammation, think of it also, cortisol is part of your inflammatory panel. So when your inflammation markers go up, that is, you need to your body thinks it's fighting something and repairing something. Like that's what it thinks it's doing. It thinks it's protecting yourself when inflammation goes up. And so if it's chronically going up, now it's going to lead to increased uh, like increased liver production of these proteins. It's going to lead to increased gluconeogenesis, right? So you start to get increased, and the cortisol leads to increased glucose as well. So they're strongly linked. And once it's inflamed, now you're glycating things, which is even worse. So now think of it as the hemoglobin gets sticky. When you have increased inflammation markers, the hemoglobin gets sticky, and that's what causes the problems with diabetes. But it also glycates and oxidizes your LDL. So now your LDL, and you may not have a high LDL, you could have a perfect LDL of 70, let's say, but now it's inflamed, and so it gets oxidized, and now it's going to cause problems to you. So the low grade inflammation is linked with cardiovascular disease. It's linked with increased blood sugar, pre-diabetes, diabetes, metabolic syndrome, and they're like positive cycles where they keep it going, right? Increased glucose leads to increased inflammation if it's chronic, and now you're getting all these problems. As far as fat cells, so fat cells, especially the visceral ones, but really all that, I don't think all fat cells, actually, you probably know that better than me. I think it's just the visceral one for the most part. But
Yeah, so it's interesting. What happens is you have that subcutaneous fat, right? So that's made for us for survival. And I think what will help people to understand is if we were made to live in a world that wasn't modern, right? And so we need to be able to store fat for famine. And then when
Mhm.
because you may go 3 days without meals, and then we were supposed to have a meal, right? And so that would replenish those fat stores. And so we'd, be able to survive in very uncertain circumstances. But what now we live in this modern world, we're not moving. We're eating ultra processed foods, overly consuming high caloric dense foods. And what's happening is you'll get the fat cell grows beyond its capacity to actually get nutrients. And so what happens in the middle of that fat cell, you can imagine it's just growing, 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 growing. And it's got capillaries and things because that subcutaneous fat is a living tissue. It makes hormones and all sorts of, like uh, appetite hormones, different things like that. So as you're growing, right, those fat cells, and you just keep saying, I'm stuffing more because I keep eating and I'm over calories, not moving, that cell goes, I'm done. I cannot accept anymore. And what happens is inside you begin to, it's like necrosis, right? You start to die. And so activation of the immune system. So what happens? You get macrophages and all these other things coming in to eat up the dead, dying cells like the immune system's supposed to, starts increasing our inflammation. In the meantime, we've also started sending fat to lap around our organs to infiltrate the muscle and all the different organs. And ectopic fat, you got visceral fat. And so that's exactly what drives inflammation, which then drives more insulin resistance, which drives, oh my God, it's like this vicious, vicious, vicious circle. So that is the main character, at least when I'm talking about people with chronically elevated white blood cell count. That's because your fat cells are screaming for help. And so that's
Yeah,
where, you know, even just movement and diet make a big difference in that setting.
huge difference. And I think of fat cells as like hormone, part of the endocrine
Yeah.
system. Things like
Yes.
they secrete things like adiponectins and
Yes. Yes.
that other one. Oh, it'll come to me. Leptin, adiponectin.
Oh
There's
yeah, leptin.
Yep.
Yeah, so
But
you're
these are they secrete pro-inflammatory cytokines as well, like the IL-6 and I think even TNF alpha maybe. And so these are secreted by fat cells. So
yeah.
once we start, especially visceral, but also like you're saying, I guess as it's expanding, they're putting out these inflammatory cells, which
Yes.
now we have a chronic low-grade inflammation. And those
Yeah.
are the kind that they actually are responsive to, like what you talk about all the time in the habit healers, is changing to a clean diet and stop eating,
Yeah.
the processed foods, even just switching over to that and
Yeah.
moving your body. They really respond to movement. And
Yeah.
if you can even just start doing light muscle building and different activities and stretching and moving, and they really
Yeah.
respond well to decreasing with that. Mhm.
100%. That is absolutely. So this is what's internally going on. Is there anything in when we think about environmentally, like, you know, outside of food, what other things that aren't on necessarily people's radars that cause inflammation? You know, like carrying around cell phones, or, you know, we're in a house with new carpets, and you know, where are we living, like next door to, I don't know, a pig farm or something? Like, what are those things that we should be thinking about outside of our immediate, you know, food supply and things like that?
Well, first, before we get there, I would say, in addition to food, that the lifestyle factors can all cause inflammation. So we talked
Yeah.
about movement, so that can cause it if you're not exercising appropriately. And then sleep, if you're not sleeping, that actually raises CRP and inflammation. It's been well documented. And if you're really stressed out, that absolutely raises inflammation, and it even causes leaky gut and worsens autoimmune. And there's a lot of data to support that. So the lifestyle factors, that alone is going to reduce people's inflammation.
Mm,
Um, you take out the processed foods and you eat clean whole foods, and when you take care of these factors, so that is always the basis to
mm,
start. But
mm,
then when you're looking further, oh gosh, the toxins, it's a huge problem, to be honest. And this is what I was talking about,
mm,
people detoxify differently. And
mm,
not everyone's detoxification system is even working properly. Like you need to do certain things to ramp it up. But so there's been studies recently coming out about people living near golf courses having increased Parkinson's,
yes, I
and
saw that.
the chemicals and the pesticides. And it's been known, I'm from the Midwest, it's been known that people in the Midwest, they use a lot of chemicals, and that there's more autoimmune people in those areas. So that is an issue. And then all these exposures, so chemicals, pesticides on food, um, uh, everything we touch surfaces, they're putting flame retardants and stuff in pan, like all of this chemicals, and they bog down our system. Or if people are exposed to mold, that is a huge problem for
Mm,
certain people. Other people can clear it. Your body has a detox system. Your microbiome can clear it for some people, and other people, they can't clear it, and they get bogged down.
mm,
These are huge problems. You asked about cell phones. For some people, it's not a problem at all. Other people, it's totally a problem. They get headaches, they can't
mm,
sleep, they have mood disorders. So EMF can be a problem for certain people. Certain sense,
mm,
people are different, and we're put together differently, and we have different genetics and different microbiomes. And so for some people, that really is a problem. But there are so many chemical exposures. Every time you buy a new bed, it has a flame
mm.
retardant. or you buy a new couch, or we have new plastics, right? We've all seen the articles about plastics being everywhere in our bodies, in our brains, in our
Disturbing.
lot in our blood vessels, like in our hearts, like it's everywhere. And so, and that does cause inflammation in some people and ramp up the immune system. So we want to
Mm.
do our best to clear as much as we can. So, but I always teach people, don't get too stressed about it. Like we all do the best we can without like obsessing about it, because that's not
Mm.
good. If we, and
Right.
I've had those moments, but you know, it doesn't get us anywhere, because it's not in our environment, in our current world, it's very polluted. And then that there's like fires and smoke exposure now. So, you know, there's so many exposures. So we
Yeah.
can do the best to keep our own detoxification system working well, and just do our best to minimize it the best we can.
Yeah. 100%. Okay. Wow, that was a lot. Yeah, I think this is a great primer of just it's just the tip of the iceberg that people can expect to see what's coming from your Substack. Like you said, those first ones are just sharing your story and bite-sized bits so you can understand and follow the story. But now you're going to start bringing in more inflammation and understanding other things. So give us a little highlight of what to expect if someone subscribes to, the Dr. Chris Miller Substack.
Yeah, so thank you. I'm trying to share one, like how my hardship, that it wasn't
Mm.
easy for me to get here, but and that's okay. It's not easy for everyone, but there are answers. So like just to like give hope that if it just because what you're doing right now may not be working perfectly yet, well, that you're just starting your journey, or you're just wherever, you know, it doesn't mean there's
Mm.
always, I feel like we can always go deeper and figure it out. And then, so I'm trying to share different things that we can look at. So I wrote one on the importance of testing. So when you follow a wellness plan, you have no idea if it's working. I didn't know my wellness plan wasn't doing the job until I tested my labs. And then I had, you know, so make sure you're keeping an eye on different labs, and that things are working for you. And then I wrote one on detoxification and how our bodies detoxify inherently, and how what we can do to ramp it up and make sure we're maximizing what we can do. And I'll be writing about sources of inflammation and trying to figure out where yours might be coming from in different anti-inflammatory diet plans that have been proven to be effective, both what the studies show and what I'm seeing in my patients. And I will say that it's not a one size fits all plan for sure. There is some uniqueness in different people. And so that's been very eye-opening and interesting for me. But you know, as you go deeper, you see that. So and then just how inflammation affects like our energy production and the mitochondria, and how it affects our aging process, and how it's so interesting, and it affects our ability to absorb nutrients. When we're inflamed, we don't absorb nutrients in the same way. I mean, it's just really amazing the extent of what it does for our bodies. And even when we're inflamed, we don't convert thyroid hormone the same way. So even if our TSH and T4 are okay, we still may be subclinical hypothyroid because we're not, when we're in that inflamed state. So it's really interesting, but there's so much we can do to figure ourselves out, get better.
I have a perfect personal story about the thyroid. So, I've been hypothyroid for what, almost 30 years, right? So I've been on levothyroxine for all those years. Went plant-based 15 years ago, 14, well, no, 2012, 13 years ago, decreased my dosage, had some really interesting things happen because of that. And during menopause, my dosage had to increase for a bit until my hormones, I got my estrogen, estradiol, and progesterone going, and then it came right back down. So it's a really interesting when you look and connect all those dots, right? I was doing okay, menopause hit hard, thyroid responded, my cholesterol responded, all those things. And so then I replaced that and it shifts back down. But very interesting that you should
Yeah.
mention the
Well,
thyroid.
they're
So,
also, I think of hormones now as a web interconnected. So
mm,
when your estrogen, one is erratic and then it's low, that's going to affect your thyroid. That's going to affect your insulin. They're all connected, and it's like, imagine you have a board, like the center ball and a big board, and you have these hormones placed. So if you pull one off, or if something that drops like estrogen, they're all going to be like, whoa, whoa, and they're wobbling, and you got to get that balance. And so when you're in balance, our bodies hum. And I really found the hormone system, it's so important to like optimizing health. So yeah,
Mm,
that's real
that's
your story. That's really interesting.
there's so
So you
many
were
cut.
able to drop back down to your normal level once you got your
Oh
hormones.
yeah. I'm a nerd for data. Like I wear the Whoop, I've worn CGMs, I check labs, I do all I'll try anything, that I find data. I'm like, ooh, I'll try that because it might help someone else too. And yeah, when I started seeing what happened so quickly too. And it was like literally within 2 weeks. I was like the joint pain thing, though, that just really killed me. Anyway, but that's a whole nother story. But anyway, guys, go right now, before you even done, he can go head over to Dr. Miller's Substack, click subscribe, and you guys will not be disappointed. You're going to learn a ton. Share it with your family, friends. We all have friends who are inflamed. My goodness, everybody has something. So definitely share it. Everyone would benefit. So check it out. And thanks, Chris. We'll be back next month. We'll be highlighting an article or some other topic and dive deep into probably a more, singular like deeper into, maybe it's thyroid health or lupus or heart disease, whatever you decide. And you guys definitely check it out. And thank you so much for being here this month with me, Chris.
Thank you. I appreciate the time. Thanks, everyone.
I'm Dr. Lori Marvis. Now, if you've ever taken a multivitamin, you've probably assumed it's giving you everything that you need. But the truth is, most women's multivitamins are filled with nutrients that you're already getting from your food, while skipping the ones your body really needs to thrive. And that's where the For Her Essential System comes in. I co-created the For Her Essential System with Complement, a science-backed supplement system that provides the essential nutrients women need for optimal health. It's designed to support hormonal balance, energy, bone health, and much more, with just the nutrients we struggle to get without the unnecessary fillers. What sets the For Her Essential System apart is that it is specifically formulated for women, with dosages based on the latest research, ensuring you get what you need, so you can thrive in everything you do, all day, every day. Now, to learn more and try it for yourself, visit the link in the description below and use the code for an exclusive discount. Take control of your health with the nutrients that matter most. This episode of the podcast is proudly sponsored by Fit Vegan Coaching, the world's leading whole food, plant-based body recomposition coaching program for those between 50 and 86. It's specifically made to help those looking to lose body fat, build lean muscle to combat sarcopenia, and strengthen their bones to fight osteoporosis. Founded by Maxim Seguin, whose personal journey began after losing his late partner to breast cancer in 2020. Fit Vegan Coaching is on a mission to help 10,000 people get lean, thrive, and reduce risk of chronic illnesses by 2033 and 1 million by 2050 through whole food, plant-based eating, and fitness. This program is the industry leader in whole food, plant-based body recomposition. They've helped over 850 people from 20 different countries transform their lives. I personally went through the program and lost 7% of body fat, gained lean muscle, and even improved my running time, all while feeling energized and healthy. They offer all-inclusive services to ensure you reach your goals, from world-class accountability to customized strength programs, tailored nutrition, and much more. They will even help you speed up your metabolism post-fat loss to ensure the weight doesn't come back. Say goodbye to the yo-yo dieting and embrace a lasting transformation. Ready to take charge of your health and vitality? Head over to fitvegancoaching.com and mention Dr. Lori for exclusive bonus savings when you sign up. Don't miss this opportunity to join this movement toward a healthier, fitter, and more vibrant you.